Hello, everybody that's viewing so far. We're going to get started in a little bit. We'll start about 2 minutes after the hour to give everyone a chance to arrive. So sit back and we'll wait for our speakers to arrive as well. I'm recording presentations for this emergency. Hey, Bridget. How are you?
1 second.
No worries.
Can you hear me?
Yep, can hear you well.
Awesome. Yeah, I just turned on. I was joined on another screen, but there was no one there. I'm not sure it was from the original send or what, but it didn't pick up for some reason. But we're here.
All right, good deal. So we'll go ahead and get started. I'm not sure if Bram is going to be able to join us or not. Um, so one quick question right before we jump in. How long is your presentation?
I mean, it can be a quick, like 20-minute thing, or depending on the questions. So I mean, it could be it could be really, really short. Are there other people on the Hangout ready to join in, or?
It's streaming live, so people can view it right now, and then we'll rebroadcast it as well.
Okay.
Um, so right now it'll only be you and I communicating, and then maximum there'll only be 3 speakers.
Gotcha. That's great.
Wanted to
That's
make sure.
preferred. Is there a way if people have questions that they could like send them, and if they do, where would I see them?
They can, and in fact I'll be asking them. They can submit them through the Q&A
Okay.
through that application. I'll be able to see them
Great.
and ask you questions from there, which should be
Awesome.
good.
So the presentation, it'll be relatively quick for those in the audience. If you have questions, I'll let you know. But if John, you're ready, I can go ahead and start and get the ball rolling.
We'll give 2 more minutes just to
Okay.
make sure, one, all the viewers are here, and secondly, give Bram a chance to pop up.
Great. Makes sense.
Cool.
And
So we'll get started. In 2. Go ahead. I'm sorry.
while we're waiting, I'm gonna go ahead and make sure that we can test the PowerPoint that we did yesterday, just to verify that you guys can see it.
Perfect.
So right now it's sharing your face because that's what's on my screen. But
that's interesting. Let me see if I can make it share your. Perfect. There we go.
Gotcha. And I'm sure if I do this, tell me, is it still visible? Because I'm going to make it full screen. If not, I can keep it this size. I just want to see if I make it. Can you still see it at this point?
I can, but can you change the slide to make sure it changes? Yep, perfect.
Awesome. So I'll just leave it here for now, and then when you want me to start, just let me know.
Excellent. You got it.
Perfect.
So we'll start in 1 more minute here.
And John, before I forget, that I do have one request at the end. If
Yes.
there's a way you can let me know, and we can do it via email or whatnot, how many people either viewed it, and if there's a way to later on say how many people viewed it even later, because it helps me keep track of the people I contact in that way as well.
You got it. In fact, it'll be a running tally on YouTube, so you'll see the count of views.
Awesome.
I'll send you that link once it's ready.
Thank you.
Yep. All right, so we're going to go ahead and get started. Hello, everyone, and welcome to this free ACA Information Session presented by Indiehitmaker. I'm John Stringer, and I'm one of the founding partners here at Indiehitmaker. So today we'll have about a 20-minute presentation, followed by a few minutes of questions and answers with our presenter, Bridget Scarborough, who I'll introduce in just a moment. But first, a couple of administrative notes. We would like this to be a discussion, so we encourage you to ask any and all questions in the QA pane. I'll be keeping track of those during the QA session towards the end. Second, if you're wanting us to go back and repeat something you might have missed, don't worry about it. We're recording this webinar, so we'll send around the recording via email by this weekend at the latest. You have until Sunday to enroll, February the 15th, so we want to get this information passed around quickly. All right, so let's get started. I'm very happy to introduce our speaker today. Bridget Scarborough is actually a certified navigator, both federally and here in the state of Georgia, for the Affordable Care Act. She actually helped my family enroll recently. I left my digital marketing position, the director of marketing, at an agency here in Atlanta and decided to focus fully on Indiehitmaker, music, my family, and some other pursuits. So I needed insurance because I had a great 2 days, 2 days with, not that it takes 2 days to do this, but I spent two different appointments with Bridget to enroll my family just because we had to get some other information sorted out. So without further ado, Bridget, thank you for joining us. I want to turn it over to you. I know you have a great presentation, and I know you have been a big help to my family, so thank you for that. Bridget, all yours.
All right. Well, thanks, John. I'm really glad that I was able to connect with you and your wife and get your family covered. But that's what I do. It sounds silly, but I'm just doing my job, and I want to make sure that anyone watching this has the base information that they need to make sure they can make the right choice for themselves and or their families or even their business, tied to what's going on with the Affordable Care Act, commonly known as Obamacare. And just so you know, there's a lot of misconceptions out there, or even just misunderstandings and aren't necessarily purposeful. We want to make sure people can make an informed decision in this process. So on the screen here, it has my email address as well as my office line. Please do not hesitate to reach out if you have questions. As John stated, I'll be reiterating this throughout this webinar part that's a little bit more dry because it's going through insurance information. But again, there will be a Q&A, but the important deadline is February 15th, 2015. We have been in open enrollment since November for 2015 plans, and it's quickly coming to an end. Today is Thursday, so there are basically 3 to 4 full days, depending on what time of day you're looking at this, on Thursday, that you have to enroll if you want to make a decision to have coverage through the system in 2015. So why the ACA was created is that the system wanted to make sure there was access available to getting health coverage. I can tell from you guys from a personal experience, a family member of mine back this past June in 2014 had a very serious health issue arise and was in the hospital for 3 months. And when my family got to the bill for the services that he was receiving at the end of the 3 months, you get the bill for everything. This is no exaggeration. This is the true bill that happened. It was over $1 million. And obviously that is not something that is realistic for the majority of folk to be able to afford. So the great news is that my family member did have health insurance. He was on the Medicare system. And so he, just by the sake of having insurance, the bill already went down and they wrote off several $100,000. But then when it came down to our family responsibility versus what the insurance company had to pick up, it lowered it down to just a few $1,000s. And again, obviously, a few $1,000s is not necessarily easy for many people. And I'm not trying to indicate it is, but when you put that compared to the liability that the family could have had if there was no insurance of over $1 million, it really put a lot into perspective. I had actually been doing this job since September of 2013. I was one of the first round of navigators to join this once they were brought on to help people in the community with this process. And it meant a lot before that, but it really helped me truly put into perspective why this is so important and why people need to have access to these resources. And the truth is there are a lot of people who did not have access to insurance. Some employers offer it, some people are Medicare or Medicaid or through TRICARE or other systems that offer insurance. And honestly, the majority of Americans weren't impacted by not having insurance. And when I say the majority, anywhere, somewhere in the 80% range had insurance. But that still leaves, close to 20% of Americans before the Affordable Care Act who did not have access to insurance. And that's millions of people. And so you may or may not have seen in the news, millions of people have been able to join rosters on either Medicaid or actively enrolling and paying for their own insurance. And that's what the Affordable Act allowed them to do, to have not only health security in their bodies, but also financial protection in case something does happen and you need medical services. The Affordable Care Act is already talked through that. Let's skip that one there too. So the key thing on here is when you're going to the www.healthcare.gov page, there is a not a limit, but specific people are set to use the system. So as I talked about, if you already have insurance, if you already have it through an employer or you're a Medicare or Medicaid, you don't need to worry about using the system. You are covered. That's one of the biggest questions I get. People think that they have to buy this in addition to coverage they already have, and that's not the case. If you have a comprehensive coverage plan that covers what was deemed a minimum essential coverage, you do not need to worry about using this system. You are covered, and you don't need to double sign up for insurance. There are a couple of stipulations for making sure that you have the coverage that you need, but there is a quick, so like if you're offered insurance through an employer and it doesn't meet essential coverage or there's certain cost restrictions or on you, we can talk about if you qualify to use the system in outside what you have, but that would be an exception type case in terms of getting the support there. One thing that I really want to point out for everyone, and I'm going to stop sharing for 1 second just to pull up something else, a quick website for you all. But I want to show you guys really quickly what the healthcare.gov site looks like so you can have information about it. And while I am pulling that up, I also wanted to speak to you all about the, give me 1 second, the pre-existing conditions, because it used to be that anyone could use insurance, or insurance companies could have charged you basically whatever they wanted. They are private businesses, they can, but they used to put all sorts of stipulations on who qualified for insurance. So it could be, I personally bought individual insurance because I had a job that didn't offer it before this started, and they were it was, I mean, I'm no joke, it was at least 20 pages of have you ever had this condition, or have you ever had that condition, and all this kind of fun stuff. And the great news is now those kinds of things are completely gone. There are only 4 questions that they can ask you that dictate whether or not you're eligible for health care through the system. It is, or what your retail rate would be through the system. It is the county you live in, because that dictates what plans are available to you to purchase. Your family size, obviously having a single person covered versus someone who, a married person with 2 kids or whatever your family size is on your federal taxes is going to be more expensive for more people. The ages of the individuals being covered, and whether you're not used tobacco. Those are the only 4 questions that will dictate how much you can get charged for a retail rate of insurance plan using the healthcare.gov system and going directly through an insurer. The reason why the income question comes up that we'll talk about in a little bit is because that will impact whether or not you're eligible for a tax credit. And so a tax credit is essentially a discount to help you pay your monthly premium. They are, again, retail insurance plans. They are not free plans necessarily. Depending on your income, you may be eligible for some plans that are at very low cost, but there's typically monthly premium and other fees that are associated with having the plan there. So this is the website I pulled up. I just want to make sure you guys can have it for reference, and I'll make sure it's visible to you all again. It's just healthcare.gov. You can put your information in. As John indicated, I am here in the state of Georgia, and so you would just go to the site, click down, put your state in. It'll verify whether or not your state uses the system. Some of the states, because I know this is open to folk more outside of Georgia as well, some of you might have a state-run program to purchase the insurance, so the site might push you to that site there, but it's going to be the same exact process, the same exact questions, the same exact eligibility. It just may be a different website you use in order to integrate and use this process here. So going back to the PowerPoint, I want to make sure that we're working through this. You do need to meet certain stipulations. You cannot currently be incarcerated. You must be a U.S. citizen or national or on certain visas that allow you to be in the country and live in a service area. Typically, if you're in the United States, in one of the 50 states, you're in a service area. In Georgia, again, I don't know of one county that's not, but your specific navigators can help you with that process in your state if there's any differences there. Very, very important deadline. Again, open enrollment has been going on. I know we talked about this before. I told you I'm going to reiterate it again, and I'm going to reiterate it at the end as well. Open enrollment began November 15th of 2014 for getting plans in 2015. If you do not sign up by this Sunday, which is again is February 15th of 2015, you can not necessarily be guaranteed to get coverage under this system. because there is an open enrollment period. If you've ever had job-based insurance, it's like a certain time when you're allowed to either opt in of a plan, opt out, change plans. That applies to the system as well. And the reason why they set that is they need to make sure people are getting in the system, and part of it for the full year to ensure that the costs can stay down across the board in terms of the folk using the system. So there are some exceptions for that, and I will talk about those in a little bit, but there are a couple ways to enroll. The healthcare.gov site that I just showed you. There are also paper applications or that 1-800 number. It's 1-800-318-2596. Again, the number is 1-800-318-2596. There are representatives there 24 hours a day, 7 days a week. We are getting closer to the deadline of February 15th, so the wait times are growing. They were extremely quick over the last several months. I haven't had much of a wait. In the last couple of days, they've grown a little bit, and so it is important, again, as you're getting closer to the deadline, more people honestly have procrastinated or whatever, for whatever reason, decided not to move forward yet. So just to be understand, you do need to be patient with the process if you're just now starting it, or if you're working to complete it, because it will, there can be some processing wait times, but you can get through it, and they're nothing too scary in that regard that I've experienced at all this year. So we talked through what it is. It's a place where what healthcare.gov is and what the marketplace is. It's a place where individuals or even small business employers can offer insurance to their families or their employees. We're not going to spend too much time on the shop, which is the business marketplace, but if you have questions, please don't hesitate to reach out or even call the 1-800 number, because they can help with that as well. But basically what healthcare.gov, and I can, if we need to, if someone has questions, I can kind of work you through how it works, but it's just like a site like Travelocity or eInsurance, where you put in your information, you talk about your family size, your income, their ages, whether or not you use tobacco, and if they're offering insurance. With those factors, you'll be able to be told pretty quickly whether or not you're eligible for insurance and to purchase it through the system, and if you are, what kind of discount or tax credit you could be eligible for. So it's a really cool, user-friendly system in that regard. And I say user-friendly loosely because I know some folk are not necessarily as comfortable with computers and whatnot, and that's where my job comes in. I'm a navigator. I'm a free resource. I'm impartial. I'm neutral. I'm not allowed to push any one company over another company, but I can help you understand your health needs, the questions that would make sense for you to think about, whether or not a doctor's in network, what prescriptions you have coverage for, where is the the nearest service area hospital, those kinds of things, that you can know and have that information before you make a decision to make sure you can choose a health plan that makes the best sense for you. All of the insurance plans must cover what are called essential health benefits. So again, when I talked before about whether or not there was a system in place about before Affordable Care Act where they could ask all sorts of health conditions, they can't do that anymore. And they also can't do exclusions. I personally, again, I'll put this out there, a few years ago, there was a lump found in my breast, and thankfully it was benign, but it was at a point where it needed to be removed. And I mentioned before that I had bought an individual plan off the marketplace before the Affordable Care Act was in place, before this was a system available. And there was a stipulation within my insurance contract that basically said if I had any breast-related issues for 2 years, there would be nothing covered. So, something that I had pre-existing or had experience with, if it happened again, that insurance company would not cover it. That cannot happen anymore. They cannot exclude you for pre-existing conditions, or they can't say that they're not going to cover something. So if there's something that you need to have that's on this list of 10 essential health benefits, it will be covered by your insurance plan. But to be clear, when I say covered, I do not mean 100%. It's not going to be a free service. As I said, there's going to be a monthly premium you pay to have the insurance. There is also deductibles, how much you pay before insurance kicks in, and then a corresponding out-of-pocket max that you will have to pay up to that amount if you need to use medical services. Some important things to think about: you need to make sure your doctor's in network before you choose that, and really looking at the prescription drug costs as well. Those are the two things that we encounter the most in terms of cost concerns that people have. I'm going to just quickly keep this on the screen for a moment because these are the Georgia-specific plans, and I know there's some other folk who aren't there. So these are just, again, the plans that are in Georgia that are available, and they're not necessarily available in every single county. So there are 9 companies offering insurance plans in the state of Georgia, and depending on what county you have, you may have more or less of these companies available to you. And then other states will have similarities. There'll be a certain list of companies that are on the marketplace that you can buy from through the healthcare.gov site, and then you can go offline to see what the other options are. To be clear, there are other companies that are available that you can purchase insurance from outside of these 9 companies in the state of Georgia. You can always go directly to the insurance company, with the caveat of still the open enrollment period is the same. So you can go to any of the 9 companies listed here directly to the site or to a rep and buy insurance. But again, the same rules apply in terms of open enrollment. February 15th is still the deadline. You could not go to any of these companies or a company off the marketplace outside of open enrollment and purchase the plan. February 15th, 2015 is the deadline to get coverage for 2015 plans, with one exception that we'll talk about in a little bit. There are 4 different levels of plan: platinum, gold, silver, and bronze. And at 5th level, catastrophic, is for folk who are under the age of 30 and, depending on your state, possibly lower income folk as well. Basically, it's your decision. So you want to choose a plan, you can choose a plan that's a bronze level that will have a relatively low monthly premium compared to the silver, gold, or platinum plan, but your out-of-pocket cost, if you have medical expenses, will typically be higher. So again, it goes from bronze to silver to gold to platinum. As you go from those levels up, they will become more expensive on a monthly basis, but things like your deductible and out-of-pocket maximum will correspondingly decrease as you go from bronze to silver to gold to platinum. So it's really your decision how much you can afford on a monthly basis and how much you can budget on a monthly basis versus what your medical needs are. And if you know you have medical expenses, or if you're more risk averse and you want to make sure if something happens you're covered a little more extensively, a gold or platinum plan may make more sense versus a silver or bronze plan. A catastrophic plan, again, is for those who are under the age of 30 in certain states at certain income levels. That is basically an emergency plan, which will make sure, again, limiting your liability if something significant happens in terms of medical needs. In order to get a tax credit, you have to make between 100% and 400% of the federal poverty line. The way the federal law was written, Medicaid expansion would have been part of this process, so folk who fell below 100% of the federal poverty line would be able to get on the Medicaid rosters, and people who make more than 400% of the federal poverty line would be expected to pay the full retail rate. You do need to be very careful with this. I live in a state that has, to this point, decided not to expand Medicaid, and so with that happening, folk who fall below 100% of the federal poverty line, they're not eligible for a tax credit or a discount because you have to be in that range to get it. But in a state that has not expanded Medicaid, unless you qualify for Medicaid under the stipulations that were there before the Affordable Care Act, you would not qualify unless you qualify for what the state has set. So it's very important to understand that not everyone will necessarily qualify for the discount. In order to, you must fall within this range, and there are some questions that we can help you out with as navigators if you have issues around your income estimation. Again, a lot of folk on this call are probably within that situation. If you have a W-2 with a set income, it's a little bit easier to predict what you'd make for 2015. But if you are self-employed or we're starting your own business, it may not be quite as easy. And again, as a navigator, we can help you brainstorm and work through that process to have a better understanding where you may or may not be in your income to help you see if you're eligible for a tax credit to help pay for your insurance. In addition to the tax credit available to you across the board, if you're between 100 and 400%, if you're between 100 and 250%, so if you're below 250% but at least 100% of the federal poverty line, if you choose a silver plan, you are under no obligation to choose a silver plan. You could choose a bronze, you can choose a gold, you can choose a platinum. But if you choose a silver plan and you're below 250% of the federal poverty line, you could be eligible for some really cool extra incentives in terms of cost sharing. And basically what that is things like your deductible and out-of-pocket max that we talked about a moment ago in terms of the bronze, silver, gold, and platinum. Under a silver plan, typically they're relatively high compared to a gold and platinum plan in the same company. But if you're under 250% of the federal poverty line, you could qualify for lowerings in that area as well. And again, we can help anyone who has questions about that process. If you do not get coverage, for every single member of your family, there is a tax penalty. We're in tax time now for 2014. If you or your family members did not get insurance, there is a tax penalty for you. For 2014, it was $95 or 1% of your income, whichever is greater. So again, if 1% of your income per individual is greater than $95, that'll be the amount. This year, if you don't get insurance in 2015, the penalty is $325 per person, or 2% of your income per person, whichever is greater. It'll be going up next year. It's on the slideshow there. And then every year after that, it'll go up and basically, from our understanding, a cost of living increase between that point. So it is important to understand that you can choose not to get insurance. But if you choose not to get insurance, there is a tax penalty you face. There are some individuals who may not have to face the penalty. If you went without insurance for less than 3 months, certain low-income areas, especially in a state like mine where the Medicaid expansion didn't happen, certain religious caveats, as well as other ones there. So if you want to see if you're eligible for an exemption, again, a navigator or someone at the 1-800 number can help you with that process as well and make sure that you can actively qualify and apply for that exemption as well, because you do need to make sure you have that on record. In addition to, you don't just not do it, you have to make sure you go through that process of getting that exemption. I'll skip this one. We talked about pre-existing conditions. The other big thing I want to make sure you think about, so a lot of times when I'm working with people, one of the things they do, they'll just jump straight into, I'll just choose the cheapest plan available to me. And again, if that makes sense for you and your family, that's fine. That's a decision you can completely make. But I always want to make sure people take a quick second and pause and think about, are there prescriptions that you need to be on? If so, what are the costs associated with it? Is there doctors, or are there doctors that you would prefer to work with, or you need to work with based upon what a condition someone in your family may have? If that's the case, think about that. Make sure a doctor's in network. Or what hospitals are allowable in there, because if you go to someone who's out of network, and depending on the plan you have, that can still have significant financial cost to you. So it's very important to think about these things and not just jump into a decision just to have minimum coverage. If that's what you need, you just really want to have that in minimum emergency coverage, great, that can work for you. But really keep in mind when you start to use the medical services, there are things to think about in that process. So again, I just want to reiterate, there are several ways to enroll. You can go to that healthcare.gov site. You can call the 1-800-318-2596 number. If you're in Georgia, I'm a navigator here. I'll put my number back up so you can give me a call. But there is also an in-person assessment finder. So it's 1-855-899-6092. That's a number anyone can use across the country if they want to find someone like me, even outside of Georgia, that is available to help them in person in that process there. And what I have here, this is the contact information for myself and the other navigators that are on my team. Again, I work at an organization called the Health Initiative. We do outreach, and we tied to the LGBT community throughout the state of Georgia. So we were brought on specifically to make sure that our community had support and access to resources tied to the Affordable Care Act. But we will help anyone in the community. And in Georgia, I'm actually going to be traveling down to St. Mary's later today, and we'll be in Savannah tomorrow. We'll be in Columbus on Saturday, and back in Atlanta on Sunday. So working all across the state to make sure there are resources that are available to anyone throughout the state. And also, of course, if you have questions, you can definitely reach out and or email at this time. So what I'm going to do is just go back to the main screen here, and we're right a little bit over that 20-minute mark, John, so I apologize for that.
Perfect,
but we are right, only a couple minutes over that. So if there were any questions that came in, I want to make sure I can answer them and, of course, be available for what's needed.
So I've got 3 questions for you, but first want to make a quick note. The great thing working about you, and I think what's great about the service you provide and what others like you, other navigators provide, is that it's a free service.
Yes.
The benefits my wife and I got where you helped us navigate through healthcare. Was it healthcare.gov specifically?
Correct. Yes.
Help us navigate through that. Help us find a comparison tool and do a side-by-side comparison of the plans we were looking at. Answered a lot of the questions we had. I don't know how long it would have taken us to go through that by ourselves. So that was an invaluable service, and you helped us enroll, fill out everything. It was amazing. So that free service, there are a lot. I remember you mentioning there are a lot of other people who may have advertising out to call them and help. How can someone ensure they're getting the free service versus having to pay for someone, other than asking them is there cost? Is there a way to recognize the people like yourself?
You can ask them specifically if, in order to use the healthcare.gov system, someone should have gone through the federal training at a minimum, and that is, it's called navigator training.
Okay.
And you want to ask them specifically, are you a federal navigator? Because agents and brokers are, again, they're great resources, but their process is a little bit different. So honestly in the state of Georgia, it's a little confusing because I also had to go through state certification. Georgia added an extra layer of certification, which again was not necessarily a bad thing. It made sure that there were background checks that were done and just going through an additional test to make sure the folk in the community are competent. But in Georgia, the way it works is it's called navigator training as well across the board. So someone does not necessarily have to be an impartial person to go through that process. So you want to ask if they're a federally certified navigator or a certified application counselor. Those are going to be the 2 main things. If they are certified through the federal government as a CAC or a navigator, they should be neutral and no fee tied to their services.
Great. So the first question, when you go direct to a company outside of the marketplace, what's the difference rather than going through healthcare.gov?
In terms of the plans, there should be no difference. So if there's a type of plan that's on the marketplace and is directly offered through the insurance company, the plans themselves should have similar, if not be identical, be similar. They should be in line with one another if they're named the same thing. The key is if you go directly to an insurance company, you are not eligible to see if you can get a tax credit. So there's not going to be a discount. You're going to be paying the full retail rate through that insurance company. So the benefit of using the healthcare.gov site, again, you would still be directly working with whichever company you chose, but there would not be the discount that you get in terms of the tax credit if you're eligible for a tax credit.
Excellent. Now, it was great for my family going through that. One, I just, as I mentioned before, left full-time employment and fully self-employed, and had to estimate what I'd be making, and it got a pretty good tax credit. So had I gone direct, I'd be paying hundreds more than going through healthcare.gov. So next question we have is for younger artists whose parents cover them, what's the cutoff age?
Oh, that's a great question. So another thing the Affordable Care Act put into play was that you can stay on your parents' insurance if their insurance company allows dependent coverage, and if your parent is willing to keep you on their insurance up through the age of 26. So what that means is not like all, not when you turn 27, but through the age of 25. So when you turn 26, they no longer are obligated to keep you on there. But through the age of 25, when you turn 26, you can have that. So if you're 20, you still got 5 years left.
Okay, that's good to know. So a lot of our clients, and we call them family members, they are artists of all different ages. So the younger age group, it's good to know they can get on their parents' coverage if they're 25 and under.
Correct. And again, there are a couple, just to be clear, the company has, some companies offer plans that are just for their employee or whatnot. So it's not across the board. It's guaranteed. The parent would have to verify if they offer dependent coverage. But if the company does, then they could do that through that age, yes.
Okay. Now I know specifically from my own experience in Georgia. I don't know if is this also the case federally in Georgia. Some of the companies were given the option whether to restructure their insurance under Affordable Care Act or to keep the plans they had before or similar that they had before. Give you an example. I was on Humana at the digital marketing agency, and for some reason our company opted to stay on a very similar plan. So it wasn't really an ACA style plan, but apparently they could only do that for this year, 2000 up through 2016, and then next year they had to switch.
Right. So they were giving them, and I was actually under the impression that it was active as of this year. So I mean I don't know the specific of business type plans. I only know I'm an expert on healthcare.gov plans, but that is correct. So there is they did allow a little bit of a window to allow folks to transition from the plans they have, but again, I thought it was this year, but it could be depending on what you're saying, and but when I talk about the essential health benefits and the coverage that needed to be there, that is needing to be in place either now or as soon as that's not going to be an option. Like any plan that's offered has to meet those minimum essential requirements.
Got it. Okay. So you mentioned the poverty line. This is the last question. Is there somewhere online that state by state people can look at? Is it just on healthcare.gov? There's a resource there.
It's on healthcare.gov because since this is a federal law, what they look at is the federal poverty line, and so it's not different state by state, with the exception of Hawaii and Alaska actually have slightly different federal poverty lines, but every other state, the 48 states are on the same federal poverty line level. So, and there is, and I can actually pull that up. Let me get that here and share my screen again so you guys can see that. Give me 1 second.
And this comes into play regarding 100% to 400% of the poverty line you mentioned before, right?
Correct. And so I'm putting in tax credit here, and it'll be a link that'll take us to that allows us to see the lines for that. So can you guys see the screen here?
Yep.
Great. Right. So there's a link that says income levels that qualify for lower health coverage. and they're right here. And then again, this does not shift state by state. This is the federal poverty level. So again, to be clear, like if someone's on the cusp of being on the low end and they may need to look at their Medicaid options, they would need to do that directly through the state. So again, this process will allow people to be, when you do the application, it'll kind of give a determination that someone may or may not be eligible for the Medicaid system, but the actual application can be pushed through on our end, but we always advocate go directly to the state agency that runs the Medicaid program, apply directly through them, just to make sure everything gets processed quicker in that process to make sure. So if you're on the cusp, you can definitely touch base with your local Medicaid office. But again, this system will do a determination, and it does push the application through. But I'm always an advocate, as an navigator, again, say work with someone who knows the system. I would say if you have the opportunity to work with someone within the state Medicaid office to ensure your application is moving through the way it needs to.
That's excellent. Well, Bridget, I can't thank you enough for taking the time to share this. And Bridget and I would like to thank everyone who joined us today. We hope you enjoyed the discussion as much as we did. Thanks for the great questions. Look for the recording by this weekend, well before Sunday, in your emails or online as well. And stay tuned for future Indiehitmaker webinars. Have a great day, everyone.
Thanks again, guys.